Good morning. My name is Maren Akyurek, and I'm going to present on programming for Two-Spirit LGBTQIA plus youth. And I am on the traditional, ancestral, and unceded territories of the Squamish, Musqueam, Stolo, and Tsleil-Waututh nations. My presentation will start with the calls to action, as I believe that that's important that we put it front and foremost. And then I'll talk about my practicum and scenario, skills in action, and that will be all. So the call to action that I've chosen is number 20, and it says we call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. This was really important to me, and I consulted and collaborated with the Indigenous colleagues that I had whenever possible. I did my placement at Directions Youth Services. Directions is located in Vancouver, and it's right across the street from St. Paul's Hospital in the downtown core. It's a low barrier resource center for street entrenched youth. They provide basic necessities such as showers and laundry, and also access to arts, so art room and media room. There's a shelter. They have an outreach team who can help the street entrenched youth get to appointments. They provide food security and opportunities for youth, such as a job action program and a youth advisory council. There's also access to medical practitioners, such as an Indigenous healer and a nurse practitioner. During my placement, I was kind of the jack of all trades. So I had one placement, but two positions. I was on the floor with the youth as a worker, where I advocated for youth, provided harm reduction supplies, and referred youth to appropriate services. But I was also a project planner, where I designed and implemented an environmental scan for Two-Spirit LGBTQIA plus youth. So why is this an important topic? This is an important topic because 30% of homeless youth identify as Two-Spirit LGBTQIA plus youth. They're overrepresented in the homeless population. These youth are also more likely to experience homelessness before the age of 16 and experience more bouts of homelessness. There are increased mortality rates compared to the general youth population, and increased mental illness, substance use, alcohol use, and sexual violence. There's also an increased use of gender-based violence when using opioids mixed with benzodiazepines, as it can cause people to be unconscious. And if they're using in vulnerable places, they are then unaware of their surroundings. So what's the scenario? Just before I approached Directions to do my practicum, they had identified a lack of programming for Two-Spirit LGBTQIA plus youth, street entrenched youth. And they didn't know exactly what was happening in Vancouver and if there were any resources out there. So they wanted me to do an environmental scan and find out what resources there were and what type of programming would be instrumental in providing access and support for youth. This is also really important because it's not just a lack in Vancouver, but it's also a lack across Canada. So what is the environmental scan process? First, I searched for all existing programs on the internet, using the internet, and I identified key places like Community in Vancouver, Youth Co, and a few other organizations. Then I designed surveys to understand what exactly these programs were. And I gave those to organizations. And through this, I cultivated relationships, which then allowed me to do one-on-one interviews with service providers. At the same time as all this was going on, we devised youth surveys and administered them to youth in the at Directions, but also at other centers that provided programs for youth so that we could find out what the differences were across Vancouver. Then I analyzed data and I wrote a report, which then informed, is now in the process of informing the programming stage, as well as how to justify this to funders. And so another part was to search for grants that they could apply for. Skills in action, integrating learned concepts. One is effective communication. I built relationships with fellow service providers in the community to enhance stakeholder buy-in for surveys. Diversity and cultural safety. I collaborated with the Indigenous outreach worker, and I provided relationship center care. I approached new ideas and ways of being with open curiosity. The next one is systems navigation. I accompanied youth to receive opioid agonist therapy and accompanied and advocated for youth at health clinic. The last one is health literacy. I provided health information to youth, and I also advocated for health workshops and speakers to be a part of the upcoming LGBTQIA+ programming for street entrenched youth. My key insight that came to me at the end of our courses together was lived experience as an asset. And I really appreciate how vulnerable and open our classmates have been with each other on the discussion boards. And it led to enriching conversation that has allowed me to grow and develop further. And I appreciate all of our continuing conversations, and I hope they happen after graduation. I'd like to thank Natalie, Renee, Heather, Jaime, Jill, and the wonderfully supportive staff at Directions. And most of all, a special thank you to my wife for her endless support and for being my biggest cheerleader. Thank you to all who believed in my resiliency and my ability to persevere. Thank you.